Welcome to our presentation on anorexia nervosa.
Anorexia nervosa occurs in about 0.5% of the population. This means that about 150,000 Canadians have or have had this illness. Significant symptoms of eating disorders have been reported by 27% of Ontario's school-aged girls ages 12 to 18. 10% of individuals who are diagnosed with anorexia nervosa will die within 10 years of the diagnosis. This is because of high mortality rates that have resulted from life-threatening medical complications and suicide among people with eating disorders. Anorexia nervosa is characterized by a distorted body image compounded by severe dietary restrictions that can lead to very low body weight in the context of an individual's age, sex, and development. This is accompanied by a strong fear of gaining weight.
I would like to represent you a case study about a teenager who won't eat. Claire is a 15 years old girl who is urgently referred to the pediatric clinic because of weight loss, nausea, and a poor appetite. She has become an increasingly picky eater over the last year or so, first becoming vegetarian and then rarely eating with her parents because mealtimes clash with her running training. Her mother thinks she goes to the toilet more often than normal and worried that she has not menstruated for the last 4 months. Claire has lost a lot of weight, and all her clothes from 1 year ago are very loose on her. She said that she doesn't think there's a problem. She said that she has lost some weight over the last year, but that was necessary for her running. She eats when she's hungry and is very careful about her diet because she needs the right foods to optimize her performance. She admits that her running performance has deteriorated over the last 2 months. She is otherwise healthy and just takes laxatives occasionally for constipation. According to the case study, what signs indicate that Claire may experience anorexia nervosa? Some of the early signs of anorexia nervosa are weight loss, poor appetite, picky eater, engage in excessive exercise, not menstruated for the last 4 months, denies that a series of problem, abuse laxatives, high achiever, engage in diet preferences, goes to the washroom more often. Is it because of self-inducing vomiting or laxatives? Following an examination, Claire's weight is 39 kilograms. That is a second percentile according to the chart. And her height is 166 centimeters. That is the 75th percentile. Her skin is dry and her bones appear very prominent. She has fine browning hair over her face. Her heart rate is 55 beats per minute and regular, but otherwise cardiovascular, respiratory, abdominal, and ear, nose, and throat examination are normal. What other questions would help to confirm anorexia nervosa? The healthcare provider can ask questions about her attitude to her body shape, eating, and weight gain. Also, symptoms of depression and obsessive compulsive disorder should be solved, as these may coexist with anorexia.
So on the topic of assessment, in addition to taking a very detailed history about weight, height, exercise history, dietary history, a 24-hour diet history, family history of obesity, eating disorders, and mental illness, we also take a menstrual history, use of ask about any use of cigarettes, drugs, and alcohol, and we use a SCOFF questionnaire to ask them, do you make yourself sick before you feel uncomfortably full? Do you feel that you're losing control over how much you eat and worry about how much you eat? Have you lost more than 1 stone, aka 14 pounds, in a 3-month period? Do you feel fat when other perceives you to be too thin? And do you feel that the thoughts about food is dominating your life?
Most of the complications are the direct result of weight loss and malnutrition. Gastrointestinal problems include abdominal bloating and constipation. These are due to the elongation of GI transit time, as well as the hypofunctioning of the colon due to lack of intake. Endocrine problems pose the most danger in the long term. Amenorrhea, which is the absence of menstruation, usually occurs. Also, the delay in puberty, which is due to the reduction in the gonadotropin releasing hormone levels, which also results in the low serum levels of estradiol. This can also lead to osteoporosis and the stunting of growth due to the lack of estrogen. There are numerous cardiovascular problems that can arise with anorexia nervosa, such as structural changes, which include reduction in cardiac mass, decreased left ventricular dimension and mass, mitral valve prolapse, and reduction of the intraventricular septum thickness. Also, alterations in electrical activity may occur, such as bradycardia, reduced voltage QRS complexes, ST segment abnormalities, and the lengthening of the QT interval. These abnormalities are due to the electrolyte imbalances such as hypokalemia.
Most patients diagnosed with anorexia nervosa are managed in outpatient settings by a multidisciplinary team coordinated by the pediatrician in collaboration with nursing, nutrition, mental health professionals. The hallmark of treatment is weight gain through diet, done in a stepwise manner, and the goal is weight gain of 0.5 to 2 pounds per week. The treatment goal is individualized based on age, height, and growth charts. In adolescent girls, menses return provides an objective measure of return to biological health and weight. Behavioral interventions are required to increase caloric intake and weight gain, and mental health experts provide psychological, social, and psychiatric care. Medical stabilization and nutritional rehabilitation are most crucial determinants of short-term and intermediate-term outcomes, whereas family therapy is essential and determinant of long-term progress. Correction of malnutrition is required for successful mental health aspects of care, and some psychotropic medications may be used in adults with anorexia nervosa. Based on the information you have received earlier in the presentation, do you think that Claire requires hospitalization? Based on the information provided in the case study, Claire will not be hospitalized at this point of her illness as her body weight is within 75 percentile. Criteria for hospitalization includes less than 75% ideal body weight or ongoing weight loss despite intensive management, refusal to eat, body fat of less than 10%, heart rate less than 50 beats per minute during daytime and less than 45 during nighttime, systolic pressure less than 90, orthostatic changes in pulse over 20 beats per minute, or blood pressure over 10 millimoles, temperature of less than 35.5 degrees Celsius, and arrhythmia. Interventions at the hospital would include stabilization of electrolyte balance through phosphorus supplementation to prevent repeating syndrome, which are cardiovascular, neurologic, and hematologic complications that occur due to phosphorus depletion. Day program is also available for certain clients that meet the criteria. It is an intermediate level of care, 4 to 5 days a week, from 9 to 5, used as a transition from inpatient or outpatient settings or to avoid hospitalization.
As a nurse, you want to keep an eye out for imbalanced nutrition and deficient fluid volume. You can do this by supervising during meals and for an hour after. Also, monitoring ins and outs is important. You should also keep an eye out for disturbed thought processes and body image. So, being mindful and listening to the patient can avoid challenging, irrational, and illogical thinking. Also, bloating can occur during weight gains during treatment. So, by reassuring that bloating is only temporary, can help the patients be more confident in their body image. Provide resources for the family. Each individual needs to develop their own self-esteem. So by reducing the need for each other's approval and expectations, it can really help the patients. Also, look for impaired skin integrity, as poor nutrition and imbalanced fluids can help lead to skin breakdown. And of course, address any knowledge deficit as it can increase the sense of control for the patients and their families.
There are three main approach that we can use for psychological treatment for eating disorders. First one is psychodynamic approach. So you emphasize on impact of early experience on the developmental stage of self, emotional regulations, and coping skills. So the eating disorder behaviors are one of the way of showing to avoid interpersonal needs or conflicts. So this approach focus on finding the underlying causes or conflicts and treat them. For the second approach, interpersonal approach, and it is different from psychodynamic, um, on focusing on the current interpersonal problems rather than the past one. And it will have four main areas to focus on: grief, interpersonal role disputes, difficulties with role transitions, and interpersonal deficits. Last one is cognitive behavior approach. So you will be looking at interplay between thoughts, feelings, and behaviors, and it will mainly focus on the main factors maintaining the disorder rather than the factors that are developing the disorders. There are a few things that we need to be considered while we are making therapeutic relationships with eating disorder clients. So first, we have to show the empathy. We can establish this by showing trust, respect, and openness. And we need to be consistent throughout the care plan. So what we need to be clear and concise, and the consistency will reduce the patient's fear or concerns. And lastly, we need to be better at therapeutic communicators. So we need to be actively listen to what clients are saying, and also we need to be non-judgmental, and we need to be uh, look at the cues of both verbal and non-verbal behaviors.
Some of the resources include Sick Kids Hospital, which has an inpatient and outpatient programs for individuals with eating disorders. CAMH has a variety of programs for individuals with eating disorders, and some of the other organizations listed here are have online supports as well. Some of the preventative measures to address eating disorders include changes in the cultural
In
approaches
April
to weight and
2015,
dieting,
France has implemented
education
a
of
ban on
families and
models with
children
BMI of less
in
than
principles
18.
of proper nutritional
Agencies
physical
who will not
activities
follow
and
those
avoid
laws
unhealthy
will
emphasis
face
on weight and dieting.
$83,000
And
fines
in terms of
and 6 months
advocacy,
in prison.
more work
Israel and
needs to be
Spain have
done
similar
with
laws.
the media in an
For
attempt to
discussion,
change the way in
do you
which weight and
think these
dieting
measures
issues
are
are
enough to
portrayed in
address unhealthy
magazines,
weight
television
representations in
shows,
the
and
media?
movies?
Why or why not? And can you suggest any other preventative strategies to address issues related to body image and eating disorders? Thank you.